I think what's interesting about wearables, though, is that it's getting people like me to actually wear a device more or less at all times. And it's almost like this flipped classroom where before
Yeah.
clinicians will request that a particular patient with a particular disease adhere to an advice, or sorry, a device. But now there's a little bit of this counterflow of patients that are bringing in their Apple Watches and Fitbits, etc., and hoping that they have some medical use for the clinician. But maybe to expand on the difference, if you can walk us back through medical devices and really the past and the present, and just how they arose, and then also for that first flow of being pushed out by programs from, let's say, a clinician, how are they
Hmm.
adopted and who pays for them?
Oh, very interesting. But before, I would like to I just recalled very interesting
Please.
meeting with Google
Hmm.
five
Okay.
5 years ago. They
Hmm.
were working on their own watch. You know, it didn't happen, but they were working. And I had a meeting with guys from Google, Variety
Hmm.
specifically, and they said, we have medical device, this one that we're using in our clinical trials. I said, okay, does this have FDA clearance? No. So why it's medical device, you said? He
Hmm.
said, no, it's medical device because we're using for medical use, for clinical trials. Okay, I was very surprised about such approach, and finally they bought Fitbit. Okay, this is the story. About your question, I don't know if many people know that the first medical device, first watch, first wearable medical device happened to be designed in 1695. In 1695.
Okay.
1695. It's a 300. How many? 400 years ago. Yeah, something like this. 300 years ago. So this is what happened. And Sir John Foer, who in 1707, if I remember, just released the first essay about how it works. So they created so-called Pulse watch. It's
Okay.
really a stopwatch, and they developed counting called today BPM, beat per minute. They developed, and who realized it? It was engineer associate of Newton. His name was Samuel Watson. Samuel Watson. And he realized this watch, and they start to sell to physicians and use it. So it's a stopwatch that enable using two hands to count the beat per minute at wrist. Interesting, right? And
Very
just
interesting.
in 200 years, it became widespread. And by the way, these guys also created all these devices we're using in sports, stopwatches, alarms, all these stuff. They created this. But in our time, the first wearable device was just Holter. Holter monitor. The first Holter monitor was commercialized in 1962, and people start to use it everywhere. And this was the only wearable device. This is the first wearable, and first wearable was medical. And in 90s, if you remember, Garmin in 1990s released the first device with ECG here, not medical, wellness with ECG,
Hmm.
some plata here and something like this. And just so I think Apple was the last, not least, but last who, who developed ECG monitor on wrist. And so it's interesting. First, it was medical devices wearables. Then it became wellness wearables. And then today it's back to medical wearables, but for specific niche we were talking about before. So this is the interesting history. And how it will continue, I think wearables are very important in some applications. But it looks like all the trend, a year ago I told that the trend is to implantables. But now I understand that people don't want to use implantables. It's a point of trust. It's a point of security. So it looks like it will be very difficult to penetrate into the market. So I think the future in non-contact measurements through the camera, like Israeli company, amazing company, Bina AI, they developed technology that enable to measure all vital signs that any wearable device, even beyond this, from the camera of their smartphone. So I think this is the future today. From the cameras, some sensors under the mattress. This is this is the trend for the measurements of patients' vital signs today, and it's mostly wearable. Should be wearable device. It's not wearable. It should be medical devices.